Hello everyone, Dr. Rawls here. The question, is fibromyalgia real? When you look at fibromyalgia, it's classified as a disorder, not a disease. And what a disorder is a collection of symptoms that doesn't have a defined cause or a defined treatment. It's basically a way to take someone who has symptoms that are unexplained and give them a diagnosis. And the diagnosis is really important because that defines the code for the physician to get paid. And that's really what it boils down to. And it does seem that there are people that have fairly well-defined symptoms that come in the category of fibromyalgia, but those symptoms overlap with chronic fatigue and all kinds of other chronic illnesses. So the difference between fibromyalgia and everything else is that people don't have abnormal lab values. And that's what it really boils down to. Physicians are looking for something that they can test for and that they have a drug to treat those processes. And so that's really what we're saying with fibromyalgia. Now, a lot of physicians look at fibromyalgia as being the same thing as maybe a hypochondriac, to say, well, we don't really know what your symptoms are, and maybe it's kind of just in your head. But in my opinion, anytime a physician has a patient who is suffering from any kind of symptom and they don't understand it, then that's frustrating for the physician and the patient too. So when we look at fibromyalgia, it's really almost a non-diagnosis, that the physician doesn't understand what the symptoms are and what to do with those symptoms, or how to really treat the patient any more than just throwing prescriptions at them to take care of symptoms. But I can tell you, anytime that anybody is experiencing any kind of symptom, there's a reason for that. I don't believe in the word hypochondriac. I think that anytime someone has symptoms, there's something going on in their body that is causing them to experience those things. And once you start looking for the causes, then you really start understanding why these illnesses are happening and what you should do about them. So if you'd like to know more about how I view fibromyalgia compared to other illnesses and how I think it's the best way to address these kinds of really mystery illnesses, please visit my website, rawlsmd.com. And also take the time to sign up for our newsletter, because every day I'm addressing and thinking about how do we explain these illnesses? How do we help people overcome them?
Thanks for watching my video. I hope you found it helpful. Be sure and subscribe to my channel so you don't miss any upcoming videos. And while you're at it, please take the time to leave me a comment. I would really like to know of any questions that you might want answered in future videos. Thanks for watching.